welcome everybody. This obviously is recorded, and then we'll show this on Thursday. So thank you so much for taking time out of your day. I'm Kay Ball, and I'm the chair of the Ohio Nurses Association Health Policy Council. I am a surgical nurse, a perioperative nurse, and I'm semi-retired from Otterbein University, where I went from full professor to adjunct professor. I only teach one course a year now, which makes it great. I've authored 4 editions of a laser surgery book, and my PhD research is on surgical smoke, and I continue to do research on that. And Sarah?
Hi, everybody. My name is Sarah Arter, and I am the co-chair of the Health Policy Committee. Professionally, I am working full-time as an assistant professor at Miami University in the Department of Nursing, currently teaching pharmacology, which goes hand in hand with my research, which deals with long-term health and developmental outcomes of children with prenatal opioid exposure. So very much a hot topic and pressing issue in Ohio, even though we have a pandemic, still a big deal. So thank you all for taking the time with us today.
Okay, and you have copies of our questions that we'd like to discuss. And so I will ask a question, or Sarah will ask a question. And if you want to respond, just go ahead and respond or have any comments about that. So yes.
Oh, okay.
As pandemic conditions wind down in hospitals, thank goodness, the foundational problems that have stressed the system for years remain exposed and impacting patient care. What can the legislature do to incentivize nurses to stay at the bedside as we see a mass exodus due to nurse burnout? And we want to know your opinion on what you've seen as non-healthcare folks, and what you think that can be done with this that would help us. Anyone want to start with that? Okay.
So I will start. Hello, everyone. I'm Minority Leader Allison Russo, former actually ranking member on the House Health Committee.
And let me interrupt just 1 minute. As you please introduce yourself before you answer the questions. That'd be great. Thank you so much.
And in addition, Joint Medicaid Oversight Committee, I previously served on that. And long before I ever came into the legislature, actually my background is in healthcare policy, and spent 2 decades working on many of these issues, particularly in the realm of safety and payment issues and incentivizing safety and good patient outcomes. So I think first and foremost, one of the things that the legislature can do and should be doing is listening to nurses. And that's where we start with this. And, I'm always so glad when nurses come on advocacy days like this and participate, because your voice matters. And you are a very important profession within this state for a number of reasons, but having your voice at the State House on these issues, whether we're talking about scope of practice issues, whether we're talking about how do we increase the nursing workforce, addressing patient safety, and COVID response, listening to nurses' voices and what you're seeing in your day-to-day work, whether you're working at a hospital, in a physician's office, or in a community healthcare-based setting, that is extremely important. So I think that that's where we start. And frankly, we need to do a better job of doing that. And, that would be my first piece of input.
Thank you very much, Representative Russo. Representative Stewart, would you like to introduce yourself and make a couple comments on that?
Sure. I'm Brian Stewart. I represent 6 counties in the 78th House District right now: Pickaway, Fairfield, Morgan, Muskingum, Athens, and Morgan. And that's all changing, obviously, by the day. So I just want to throw in, we have been listening to the needs that are out there. House Bill 169 was a bill passed in December, which was amended in the Senate, and the House concurred, which added roughly $32 million for pay, bonuses, incentive payments, all sort of designed to address the issues that we were having. My wife's been a nurse was a nurse for 12 years, has been a nurse practitioner now for 2 years. And so beyond what I, hear as a member of the health committee, I go home and hear quite a bit more. And, my wife started as a nurse practitioner in January of 2020. 6 weeks later, she's helping run the COVID clinic, and full hazmat suit all day, every day for about two months. And so very familiar with the burnout. In December, a couple months ago, she's an urgent care provider, and they're seeing 90 to 100 patients a day. Part of what I think hopefully is going to help is getting back to a little bit more of what's normal, right? I asked her yesterday, how many patients you have? And we had 15 to 20. Those patient loads do a wonder for burnout and just the stress that goes into this job. And I think hopefully we are getting close. But that $32 million was from the American Rescue Plan, the ARPA dollars that we're getting from the federal government. More is on the way, and there's going to be multiple other spending bills that we're dealing with here this spring that are all sort of designed to try to put those federal dollars that we're receiving to the best use. And I can tell you that Representative Manchester and I stood up in our caucus when that bill was coming back over to say the burnout is real. Aides are leaving, nurses are leaving because, if you can make as much money working at Panda Express, you get yelled at quite a bit less than you do working in an urgent care or emergency room in December of 2021. And so I think we recognize the need for those sort of incentives. We all love our jobs, but at the end of the day, we're working to make a living. And I think that pay and compensation, we've got to do what it takes to keep skilled people in the profession.
Yeah, thank you very much. Every bill that ONA is supporting, that kind of helps, incentivize nurses when they're passed to stay in the nursing profession. And Representative Manchester, would you introduce yourself and have a few words on this issue?
Absolutely. Thank you so much for having me. My name is Susan Manchester. I represent the 84th House District, which covers 4 counties: Auglaize, Mercer, Shelby, and Darke. I have a very rural district, and so healthcare and maintaining a healthcare workforce in my area is very critical. And I think we have seen firsthand just the importance of what nurses do in providing quality care. And I want to say thank you to all the nurses that will be joining us for all the hard work that you put in. It's clear that the stresses of these past 2 years have not been fair to anyone, and those who have been on the front lines, I think, deserve the utmost respect for what they've been through. And so I just want to say thank you to all of you. And I would agree with Representative Stewart. More and more, we're recognizing that it's the workforce issue that we're dealing with at the end of the day. We have to make sure that we can maintain a strong workforce for nurses and that we can encourage people to get into nursing as a profession. I think that's also something that could be quite challenging the next couple of years, especially for students who have gone to high school and maybe even college during this pandemic time. Perhaps that's not a career field that they've been as interested in. And so I think it's important that we offer good incentives and do our best to ensure that we're encouraging people in that direction. So that is something that I've been supportive of in the legislature so far.
Thank you, Representative Manchester. Senator Rugner, did I pronounce your name right?
Senator, correct. So my name is Senator Rogner. I represent the 27th Senate District. That includes Wayne County, Western Stark, and a good portion of Summit. And I've been on the Health Committee in the Senate. I'm in my 4th year now there. I think a lot of great things have already been said. And the healthcare, the nurses, you guys were on the front line. You truly are our healthcare heroes. And, we thank you everything that you've always ever done, but particularly now through the last 2 years where it's been incredibly difficult. Thank you for that. As I've been listening to all the comments, I agree that certainly while I truly believe the vast majority of people get into nursing, the healthcare profession, because they have a heart, because they want to serve and help heal people. I mean, that's just in their nature. And that's why they're heroes. That being said, certainly there are things that we can do and should do to make their jobs easier, not make it more difficult, and ensure they're incentivized properly. You know, I've heard some of the previous panelists talk about the incentives, and so that's great. I agree with that. In terms of making their jobs easier, one of the things that I've been working on was the Nurses Compact. So that joins Ohio to the multi-state, and there's 30 plus states now that are part of this compact, so that they can get a multi-state license, and it takes down these barriers so that they can serve patients out of state. They can travel, other nurses can come to Ohio. It just makes it a lot easier. So one less hurdle that they have to grapple with across these state lines. But then also, I guess I'd be interested in hearing about, I know several nurses, I live in Hudson, Ohio. They work, actually one of them's with the Cleveland Clinic. The other one's a traveling nurse, where they both had COVID like over a year ago. So they have natural immunity. I think they had it, and they don't want to be vaccinated, but yet their workplace is requiring the vaccination. So I guess the question I have, and I don't have an answer for this, I'd love to hear a perspective at some point from ONA. You know, one of the ladies, like, I think I might have to quit my job. Then eventually, I think the Cleveland Clinic backed off from that requirement, but she was very stressed about that because she'd been there for over 30 years. And I think that single thing was stressing her out the most. So I don't know. I don't have an answer to that. There's just a point I'll get some feedback on at some point. But my point is, we should not be making their job harder, right? Stressing them out further with mandates or requirements that if they're not necessary.
Thank you for that comment. And, you know, this is such a new virus to us, even though we've had messenger RNA vaccines for many years. And we're learning, and you know, things may be changing, and who knows, as we learn. We just want to protect the public and the population. And so I appreciate your comments on that, Senator Regner. So Representative Tom Young is on too. And you just introduce yourself.
Good morning. Tom Young, 42nd House District, Centerville, Washington Township, Germantown Township, Miamisburg, Miami Township. I would just ask, what aren't we doing? I mean, we have been doing quite a bit, but what aren't we doing over and above what we have already done and what we already have in the pipeline? What else is there?
Okay, thank you very much. And I see we have a Ryan Colress and a Andrea White. Are you representing?
Ryan Colress, Legislative Aid.
Oh, okay. Thank you for being here too, because you all are so important to the relationships we have with legislators. And Andrea White, you're with?
I'm a representative from Kettering.
I am so sorry.
Oh, no, I'm glad to be here. I apologize for the delay. I represent Kettering, Centerville, Riverside, East Dayton, and Oakwood right now. The district is going to be changing, but so there's lots of nurses, lots of healthcare in our region. Thanks for having this discussion. And, I'm interested to hear what your priorities are as of right now. Thanks.
Okay, and do you have any solutions we can even think of how to incentivize nurses to stay at the bedside, because we've lost so many due to this pandemic and other reasons?
I'd be interested. I think you are closest to where the nurses feel that they need. I think we need to do a much better job of getting more people into the nursing profession, working with the career tech programs, opening up bachelor's degrees in our community colleges, which I know we're doing in Sinclair, just working on those partnerships. I think the healthcare providers and the nurses are in the best position of saying what motivates them. Certainly we're paying a fortune to all of the traveling nurses, and we've got to do a better job of shifting that to paying our nurses and our healthcare professionals to stay in the profession. So I'm interested in your ideas. I know there's been incentives talked about. Some of the healthcare organizations have initiated those, but it has to be a long-term sustainable thing. And to me, that is about getting more students interested and exposed to healthcare professionals, building relationships with those career tech programs, the community colleges, and the four-year degrees. But let's hear from you guys.
I actually really appreciate that. I'm going to jump in, and I think you jumped on later. Just to introduce myself really quickly, my name is Sarah Arter. I'm the co-chair of the Ohio Nursing Association Health Policy Committee. And just until recently, I'm full-time as a professor, but I did still work part-time at Cincinnati Children's Hospital in the cardiac ICU. And I will tell you, just from being a nurse for almost 15 years now, nurses don't go into nursing for the money. I mean, certainly they want to be reimbursed at an acceptable level, but that's not really the reason they're there. They're there because they're servants. They want to help people. They really want safe staffing. I mean, that's the biggest thing. I've seen more nurses leave nursing, the profession as a whole, not just go somewhere else, but stop being a nurse and go into things like real estate, just because we can't do the job that we know that we can do when we have to take care of way too many patients. And granted, there has to be some grace there when we're in the middle of the pandemic. You know, hospitals can't do anything about that. But outside of a pandemic, I really do think that that is one of the things that's not only going to recruit people to the bedside, but retention is going to be a huge issue. I think that's where we need to focus. And ONA is focusing on that. That's one of our top priorities for the next year. We heard that from our members. We want safe staffing. So hopefully we can all work together for that.
We hear about the nursing shortage all the time. I think there's some nurses out there. We just have a nursing staffing shortage, and and a lot of it is workplace safety. You know, I'm going to talk a little bit later on Senate Bill 161, the smoke evacuation bill that we have. Surgical nurses report twice the incidence of respiratory problems just because of working in a surgery environment where we cut and coagulate and we form surgical smoke. And so I think a lot of it is workplace safety, scope of practice, and things like that will try to keep our nurses in the field.
Can you elaborate when you say safe staffing, what all are you including in that so that we can keep that in our target?
Well, there's many, and ONA would be the best people to talk to about that. But you have ergonomics issues, you have workplace violence issues. It's crazy in the ER. You have do we have the right safety equipment to provide a safe workplace environment? Just the number of nurses and how many patients, patient ratios. And we're going to talk a little bit on each one of these as we have questions today. And I think with these other questions that we have to ask you, that you're going to have a better insight on what the nursing community needs to have a safety environment and an environment that we want to work in. And so I'm going to turn it over to Sarah to ask that second question then.
Really quick before I get to the second question, and thank you for the great discussion. This has been really nice and fruitful so far. But in addition to all the issues that Kay mentioned, the other thing that I was thinking too is putting a cap on the number of patients each nurse can be assigned to. That is what I hear the most from my colleagues, is it's not safe. I mean, I now am mostly in the clinical environment with my students. And so I'll get there early and listen to the charge nurses, the night shift, give report to the day shift. And sometimes they come in and they're like, how was your night? And they're like, we can't do the job that we want to do because each nurse is responsible for too many people. They're spread way too thin, and that leads to patient death. I mean, we have the research that shows that, but it's hard to walk into an environment day after day knowing you can't do your best because you just have way too many people to take care of. So yeah, so that's a big issue too. But yes, let's move on to question number 2. So for all of you, what do you see as the biggest change in healthcare coming out of the COVID-19 pandemic? And what does Ohio need to do to respond to that?
I'd be happy to start with that. So this is Senator Rogner again. I think one of the biggest changes we're seeing coming out of pandemic is the use of telehealth. I mean, it was really in its infancy, I guess. It started before the pandemic, but wow, did it really take off. I mean, I had to have knee surgery last January, and I had to have this pre-meeting with the anesthesiology team. I mean, they actually had no out and look at the camera, and I was like, what are you looking for? The size of your airways. And it was fascinating, but they really did it. And I think it worked really well. And then all the follow-up visits were telehealth, and it was so incredibly convenient as a patient, from the patient perspective. I'm like, I didn't have to drive to the doctor's office, wait in the waiting room, then drive all the way home, burning all that gas, and take what basically is a half a day out of your time for like a half an hour meeting. So telehealth really is taken off. And I think that's a good thing that came out of the pandemic.
So I would simply, and I agree, telehealth obviously has taken off in a way that I don't think, any of us anticipated, or maybe we did anticipate, but certainly not quickly. I'm always reminded of the phrase, necessity is the mother of invention. And in many ways, if we were to take some positives away from this pandemic, I think our ability to innovate quickly, and that was certainly one of the ways that we found to innovate. The only thing that I would say is, we do have to balance as we think about telehealth and how we continue to use this, especially amongst the nursing profession and in this innovative way, is that we don't inadvertently, because of the lack of consistent access to broadband technology across the state and in some communities, that we continue to expand those disparities in health that we already had pre-pandemic. And that if we shift too far, even to that even as we're sort of shifting into more of the telehealth modalities, that we don't inadvertently, because of that lack of access, which as a state we have also been working on. In fact, Representative Stewart had a great bill that came through this General Assembly, that we are thinking towards, are we still addressing those disparities in communities where they currently exist and may continue to exist even with adaptive technology. The other thing I would just say, I think the other thing that has come out of here, and again, the pandemic did not necessarily create new problems. To me, it just exposed problems that already existed within this, within healthcare, and it just made them just so apparent to us. And, this is going to be a theme as we're talking today, but really the workforce needs that we have all across the healthcare sector, but particularly in nursing and in some of our nursing support staff. And, we have to continue to address that. But I would say, and I think it was interesting, Kay, you mentioned this, that this is a nurse staffing issue, because I represent the Columbus area and Franklin County. Our ability to recruit nurses here is very different than, say, the ability somewhere where Representative Manchester is. Not only are we recruiting nurses and we're getting nurses into the state of Ohio, but we're getting them into the places where we have the highest need and into the communities and neighborhoods where we have the highest need. And that requires a little bit more, I think, intentionality in some of our policymaking. Because, we can get more into Columbus or more into Cleveland or more into Cincinnati, but where the needs are highest are in many of our communities that are outside of those areas.
I would just, I think one of the biggest lasting effects of the last 2 years is just our attention to healthcare. There's an awful lot of people who had not been in a hospital or not been to a doctor's office for a very long time, and be it for themselves or family members. I think we were all just, you get on Twitter, you see it. It's like everybody fancies themselves, an expert on some degree of healthcare after the last 2 years, and everybody has been sort of following and by necessity had to be more engaged with healthcare. And I don't know that we're going to know all of the ripple effects of that immediately. I think that is a substantial sort of cultural change. A lot of people who are 40 and under and really had never had to feel terribly vulnerable did, right, over the last 2 years. And so I think that's going to sort of have ripple effects in a lot of ways. I would also just add from a workforce standpoint, a lot of folks who went working remote aren't coming back. There's a lot of companies that are going to be work from home permanently. And I think that's only going to sort of solidify and potentially expand. Well, that's a bit of a challenge that's another challenge workforce wise for hospitals, because how long are some of your nurses going to be happy about continuing to come in every single day while, their spouse, works from the den? I think there's just some ongoing kind of cultural changes that are going to make things more challenging. It's like we may be cruising towards a situation where, the healthcare field is maybe one of the only fields that is fully in person, because obviously, you treat the patients where they are. You can't telehealth aside. And so I think that's going to be just another sort of challenge of how do we keep people engaged in healthcare. And we're going to have to, the market's going to have to kind of adjust for that.
Representative Young, do you have any thoughts on this question?
No, I think Brian did a good job.
All right, let's move on to the next.
The only thing I would add is that we have non-traditional roles being utilized for things that we never thought of, such as pharmacists administering vaccinations and being able to do a broader scope, as we talked about, scope of practice. So where the people are in the under-resourced areas, how do we get people who already have relationships building better wellness and positive health and prevention practices? Because we're not going to, the system isn't going to be able to support itself in its current model. We need healthier people, all healthier people.
Or also maybe state-funded education initiatives, or, where you have people that train and get the tuition paid for. So then, in agreement, they will go to the rural areas and work for 3 to 5 years to help cover some of that.
That is a challenge. I think you hit on a very important aspect of, because in most perspectives, we're talking like Susan, Representative Manchester, lives in a rural area, and we forget that 81 counties are tiny. And not only do we have shortages, I'm working on a project outside of this, shortages of nurses, but also psychiatrists, specialists. We are failing miserably at the moment. So I don't really know if it's a funding issue, but it is something that we have to have a full court press on. I mean, we have Intel coming is a game changer, and we're going to have to address all the outlying areas. How do we functionally support those? I think going forward, that's one of the largest and imminent challenges we have right now. It's not going to go away anytime soon. I think the other thing is that we have to look at how we educate our nurses, because the shortage, I have probably 15 people in my family who are nurses. And the challenge is, where do we find the teachers? And I served on Wright State's Board of Trustees. That was our biggest challenge, because state universities can't afford to pay what corporations can pay. They have limits. And we have to address that. Maybe, there are nurses with experience that may not have a master's or doctorate, that with hands-on experience can teach at a level that perhaps a master's degree teacher does not have. And so those are the two priorities that I think we really have to address very quickly.
I agree with that. Sorry, go ahead, Kay.
I agree with being a professor of nursing at Otterbein University. I definitely agree with you that there is a shortage of that, and universities. We lost like 4 people on our staff at Otterbein and have not filled them yet, because the university says, well, you can fill them soon, but it takes a minute to get a professor. So Yeah, we have a lot of professors leaving because of the overburden of the number of classes that you have to teach. So yeah, we need to really focus on that.
We're seeing that quite a bit, but I would agree with Senator Rugner, because what we learned from the pandemic in regards to nurses on the front lines, the ratios are the challenge, right?
Yes.
And so, and if you go into the hospital, you don't want a nurse taking care of 19 people,
Right.
your loved ones in the hospital, right? But we have to be realistic too. I think the hospitals pretty much screwed themselves in this situation. I think that, you can't put nurses and support staff in a situation where they are totally exposed to COVID for over a year, and then a vaccine comes on board and you kick them to the side. I mean, that was the most, that to me was absolutely incredible. And whatever people's opinions are, that's fine. But when you're in a crisis, it's all hands on deck. And if people are willing to make their decisions personally, we have to abide by those, because that puts us in the situation we're in. 20% of the female workforce dropped out. So far, we have not seen them come back yet.
And I do think and hope that these conversations continue even after we hopefully pull ourselves out of this current pandemic, just because we're going to end up dealing with these situations again. So it'd be great to be prepared for them. And then only one other comment about having enough people coming into nursing programs. We have a lot of interest in nursing programs. The educators is the issue. And you're right, it's not just nursing, it's other healthcare disciplines as well. But at Miami, we started a nursing program on our main campus 4 years ago. We have our first graduating class this year at the end of the semester. And it is now the most competitive program at Oxford out of all of them, because we have to turn so many people away because we don't have enough educators. It's crazy.
Exactly.
Well, and this is the big rub, because we've all been hearing this from the different, the most in-demand jobs, nursing and other healthcare professionals, but yet we don't have enough space in our programs in Ohio to train people. They can't get in. And so what are we doing, as Rep. Young mentioned, to provide bridges for people that say they don't want to be at the bedside anymore? What are we doing to recruit these people into the teaching realm? What are we doing to do that comparison of degrees versus experience? Do we need to change some legislation? Do we need to fix something there? I mean, what are your thoughts on that?
Well, Sarah, why don't you go on to question number 4, and then we'll bounce back to 3 in just a minute, because that kind of has something to do with it.
Sure. Okay, so number 4, speaking of education, so Akron Children's Hospital now has a 15-seat associate degree in-house nursing school, where they actually pay the students a wage to attend their nursing school, and it's also a tuition-free program. And also I was looking into it, and they provide free childcare as well, which is great. And then upon graduation, they have a position at the hospital. So this not only helps the nurse staffing crisis by feeding the hospital directly with its own nursing students, but may provide disadvantaged people in our local communities the opportunity to become successful and climb their way out of poverty. Would you support a statewide effort to create more programs like Akron Children's throughout Ohio?
I think
the program at Akron Children's, just a point of clarification, is that being totally run and organized, everything through Akron Children's?
I don't know 100%, but based on the reading that I did, I would say yes, it is. It's probably similar to in Cincinnati, we have Christ School of Nursing that's completely run by the school.
Okay, so I don't know the program other than what you just told me right now, but it sounds to me like that's the free markets working, which is beautiful, right? I mean, there's obviously a demand for this type of skill, and nurses, and the hospital sees it, and they're going to do what they need to do to attract the candidates in the workforce to come, whether it's, and I think it's brilliant to have it in the hospital, because they can learn academically, and then they can go and see it clinically right there. They can probably help out in many ways, even while they're still students. I imagine that's why they're possibly being paid while they're studying. I think that's a great model. And if they're successful, I think you're going to see that probably replicated across the state at other hospitals, even without the government getting involved. And in fact, many times my preference is to not have the government involved if we can help it. because oftentimes government will just mess it up, but let the free markets work.
They say history repeats itself. All the nursing schools started in hospital environments and then went to academia because of a more well-rounded nurse, they say. And so we're seeing some repeat because we have such the shortage out there and we need to fill.
Good thing.
Okay, let's shift gears a little bit. In its current form, House Bill 466 seeks to increase regulations on healthcare staffing agencies with registration requirements and limiting the amount a healthcare worker can be paid. So do you support capping how much a nurse can make? And someone mentioned, yeah, we have travel nurses. They're making a lot of money today.
No, I don't think nurses should be capped. I don't believe in, again, in any sort of artificial caps or or floors for that matter. I think that the free markets work, and I think right now there is such a demand for nursing talent that the pay is going to go up, and it should, right? I mean, as I mentioned at the beginning, I think one of my first comments was, I don't believe in my heart that nurses got into this profession primarily for the money, right? I mean, yes, they should be compensated fairly, absolutely. But I think most of the nurses out there are doing it because they care about patients, they want to help people, they want to heal people, and they're in it for the right reasons. That being said, again, back to the free markets, I would not cap how much a nurse can earn because if that skill is needed, the hospitals are going to pay for it.
I agree with the senator. Absolutely.
I'm not a legislator, but I agree too.
Well, let's shift gears just a little bit more. According to a 2017 survey from the U.S. Department of Labor Statistics, healthcare and social service workers experience 69% of reported workplace violence injuries. So this is a big topic right here. And they are nearly 5 times more likely than other workers to be assaulted on the job. And this problem has gotten worse over the past decade. The rate of violent injuries grew by 123% in hospitals, 201% in psychiatric and substance abuse facilities, and 28% in social service settings between 2007 and 2017. So would you support workplace violence legislation to help Ohio nurses?
I'll take this one first.
All right.
I can count on too many hands the number of times that my wife's come home from working at urgent care and COVID clinic for the last 2 years and said, I thought he was going to hit me. I thought he was going to come at me. I thought she was going to hit me. It's way too prevalent. Look, it is a stressful environment. I'm not going to minimize that. Emotions are high, stakes are high. I know that, human nature is human nature. And I know people are going to sometimes not be at their best in a hostile situation. That's never an excuse to put your hands on somebody. We've taken other steps in the General Assembly to acknowledge that there's some professions where we need to make even more clear and set an example that this is not okay. We've done it for countless other professions. I have no issue with saying, we need to look at, now I think the focus should be on the people who are making threats and who are actually putting their hands on people. I know there's different maybe views on where we need to focus our time. I'm definitely going to say it needs to be focused on folks who are doing the wrongdoing. I think hospitals want to keep their staff safe. I think employees generally know what they should be doing to keep themselves safe, but there's only so much you can do for somebody who wants to resort to violence. And I think we need to start drawing some pretty sharp lines in the sand and say we're not going to put up with it.
The experience of an ER doc and an ER nurse in our inner cities, our urban areas is it's pretty amazing. Well, actually, I have a lot of clients who are out in some of the rural areas as well. And the ER room is where a lot of the violence occurs. And, they almost have it down to the day of statistically their highest volume of occurrences in those types of situations. So I agree with Representative Stewart that we should absolutely do. First of all, it's uncalled for, but you do have a challenge of committing to care in a situation where it's usually not the patient, it's the patient's family. In most cases, from talking to my clients, but absolutely we should do that in any case, especially in the hospital setting. I'm going to have to get off of this meeting. I really appreciate it. I'd like to talk more, but I have to go to another appointment.
Well, thank you so much for being with us today, and I'm sure we'll maintain relationships with you, and so that's so important. So you hear our story, we know your beliefs too, and so we can work together and partner and be successful. And
Sarah, love and honor.
Thank you.
Okay, I just wanted to add, to this conversation, we talk about certainly the workplace violence issue is one piece of this, but also noting, and I think you mentioned this before, that nurses have some of the highest rates of workplace injury as well, and I think that speaks to the continued need to think about the safety of these work environments. And there have been several stories about this, but one of the concerns that I think has emerged in the last 5 to 10 years is that as we see a shift of staffing to contract staff, even travel nursing, or we start to see some deregulation within the hospital setting, that we then increase, some of these injury opportunities for injury, whether it's through violence that we see with patient interactions, or it's, not having the right equipment, for example, to lift patients and transfer them into bed. So I think, always keeping an eye on those unintended consequences of how that impacts the safety of the workplace, particularly for our healthcare professionals, is something that we have seen continue to emerge over the last decade, and need to continually be thinking about, especially when we start to have these conversations about is it too much regulation, not enough, that those do have the unintended consequences of putting some of our workers at higher risk.
Right, and there's some incidences you really don't even think about. I remember being a surgical nurse in the OR and being on call and coming in on Christmas Day for a gunshot wound to the head. And it got into the wee hours of the morning, like 3 a.m. And I'm, my patient's in recovery, but I'm taking the bullet, the evidence, down to the laboratory and having to go through masses of family and friends and maybe somebody trying to get this bullet, which is evidence. And, you don't even think about what's your safety going to be like as you go through this. So we immediately changed our policies where a nurse wouldn't have to take a specimen like that down in the middle of the night to the laboratory. But there's so many different incidences we have to look at for workplace safety, and it's even the air we breathe in, or the ergonomics of having to move a 400-pound patient. That's more safety, and that's that nurses are exposed to all the time. So we have to think about all that, not only workplace violence too.
You mentioned about the 69% of workplace injuries. What was that statistic again?
Okay, that according to the U.S. Bureau of Labor Statistics, healthcare and social service workers, nurses and social service workers, experience 69% of reported workplace violence injuries. So that's 5 times more likely than other workers to be assaulted on the job.
Okay, so what I'm wondering about is, was that statistic pre-pandemic? Post,
yes,
where
it was.
Okay,
yeah, it was.
And then in terms of the workplace violence and injuries that you're seeing, has there been trends in the past 2 years as we've been in the heat of all the shortages and the crisis and really the devastation that's been wreaked by the pandemic? Has it gone? Do you have stats that show it's gone considerably up compared to what it was pre pandemic in Ohio.
Yeah, and
Just
I
curious
don't have
that
those.
we changed our security provisions in the hospitals because they're short-staffed too. I'm just trying to figure out what environmentally, beyond the environment of the pandemic, has changed, and the culture of violence that we all see all around us in all the
Absolutely.
gunshot wounds that
That's
are
a great
happening.
question, a great request. And I'm sure O&A will get back with you on that information. I don't have it right here in front of me. My statistics suggest the increase pre-pandemic has been so much that we can get those statistics for you too. So I'm sure O&A will be in contact with you and other legislators as we put forth ideas about workplace violence bills too.
Just thinking about what's changed in the last few years that's contributed to that would be helpful, so we can look at solutions to target that.
Absolutely. Thank you. So Sarah, you want to go on with your question?
Sure. All right. So this next question actually kind of gets back to some stuff that we were talking about before with safe nurse to patient ratios. So issues surrounding safe registered nurse staffing levels have been on the forefront of healthcare discussions. I mean, this isn't a new issue at this point. And it has been well studied in the US, which is good for us. The research studies have established a direct link between patient outcomes and nurse staffing levels. The evidence supports the need for appropriate nurse to patient ratios to ensure the safety of the patient and their families and assist to offset the climbing cost of hospital care. An increase in a nurse's workload by one patient increased the likelihood of an inpatient dying within 30 days of admission by 7%. So knowing this information, how do you guys feel about supporting legislation that would establish safe nurse to patient ratios?
So I'll start with this. Ironically, in my career before I ever entered politics, this issue of nurse patient staff ratios was one of the very first projects actually that I ever worked on. So I feel like I'm having a full circle moment here. And the evidence here is very clear, and I know certainly there have been efforts, at least at the federal level, when we look at how can we best incentivize good ratios, tying in some measure opportunities in that space and tying it to reimbursement for care. And I think there have been some states, and Sarah, correct me if I'm wrong, some states who have gone down the path of, actually mandating from a state perspective, the ratios. I think that in general, I think the concept is certainly one that is well supported by the data. I think it's always thinking about how is it put into practice, particularly for some of our smaller hospitals who already struggle, number one, to stay in the black, but number two, also struggle with workforce issues. And so I think that, it's something that's going to require a lot of discussion. That are there ways besides just strictly mandating, are there ways that we can incentivize that as a state? And I don't know all the answers to it yet, but that's where I fall on this.
I tend to agree with that. And I think a discussion would be wonderful on a broad level, not even just in health committees, but even if mandating ratios is not the right way because one size doesn't necessarily fit all with all different types of hospitals, some people have implemented algorithms to try to figure out the best safe staffing. But, where is the right place for that type of discussion between nursing and legislators? How can we work together to get that done?
I would just jump in and say, I think this is something that the pandemic has really provided an opportunity for hospitals to consider what nurses should actually be responsible for and what can maybe be delegated outward so that it is more of a team approach to the patient. I actually just had a conversation with one of the CEOs of one of the hospitals in my area about this and how they are looking into how to develop a new way of approaching patients so that you can deliver care effectively and have the safest environment for all of your employees. Because as we've stated throughout this whole conversation, everybody's experiencing shortages. Everyone's had to re-examine how we deliver care in the best way possible. And so I would prefer to see the hospitals themselves consider that. And because, to your point, one size doesn't fit all. And so the idea of mandating something at the state level is not the approach that I would like to see, but I do think that hospitals are being forced to consider that and are being forced to think about how we can best deliver care in a team approach that is good for the patient, good for the nurses, good for everybody involved. And so I'm really hopeful about that. Again, didn't come about in an ideal way. Obviously, nobody wants to have to re-examine out of the fact that there's not enough people. But at the same time, I think, one of the examples given is, like, should the nurse always be responsible for bringing the patient more water or food or, something like that probably could be delegated to someone else, and that would still be okay. The patient would still be getting good care. The nurse would be a little relieved from all those responsibilities. So I think that is a really positive move on the part of the hospitals to think about it in those terms.
Our next question is kind of similar to that too, and that deals with the healthcare provider fatigue. And there's been multiple evidence-based research studies, and authorities have linked the healthcare provider fatigue with sentinel events, including people dying, patients and healthcare workers. So what would you suggest a way to solve this problem when somebody is just totally, they've worked 2 shifts in a row and they want them to work another shift with fatigue and healthcare fatigue and all the problems with that? What advancements in Ohio are going on that you know of?
I would just jump in. This is Representative Stewart for folks who are listening. The House has passed this year, House Bill 163, that prohibits mandatory overtime. I think that was passed overwhelmingly bipartisan bill. And I think it was, and a lot of the arguments made for the bill were sort of along those lines. Is obviously, if you feel like you can, take on additional shifts, go ahead. But that if you feel that you cannot, work beyond those full shifts, that it would not be cause for termination. I think you run into some of the same kind of concerns and issues with, trying to set sort of an arbitrary, nurse to patient ratio. But I think it is, we have acknowledged that this is an issue that needs to be looked at more closely. And so that's sort of one step of potentially many. But I think that the hospitals are sometimes just the statistics of, for example, my wife's worked at some systems where, the nurse to patient ratio seemed really high, but the quality of care was excellent. She's worked at other systems where nurse to patient ratio was much better, but quality of care was not. And so I think in the same sense here, it's not so much just a question of how many hours am I working. It's are we making sure that we have other systems and policies in place as a hospital to make sure that you can't control sometimes when your patient load spikes, and when folks are coming through the door, it's unpredictable. Sometimes it's kind of varies wildly, and so I think we have to be careful about not trying to force a square peg in a round hole here, and in a way that diminishes our ability to provide for that.
Thank you for your comments. Yeah, we have to get this bill that was passed in the House into the Senate, through the Senate committee, the Health Committee too, and onto the Senate, so we can see some action with that. But thank you for your comments. Anyone else?
I was just going to say, I think, ultimately, a lot of this goes back when you look at what can the state do? Well, we're looking at our reimbursements, right? What does the state pay for the cost of care? And so then looking at, of course, hospitals are businesses. And so decisions are made with bottom line in mind, as well as patient care. Let's face it. So the bottom line to think about downstream, of course, is hospital utilization. And what are we doing to keep more people that don't need to be in the ERs, that don't need to be using the hospital-based healthcare outside of that? I know there's been a lot of work towards that. It's almost like looking at how we reimburse nursing homes versus home health. What are we doing to incentivize and reimburse non-hospital based healthcare? And I think there's an opportunity to look at that even more than has already been done.
Thank you. Thank you. We're going to wrap this up, and just one quick message to the nurses out there that it's so critically important to form a strong, a trusting, a respectful relationship with legislators, because they need to know you more as a nurse, and nurses need to know more about the interests of the legislator too. And so there's so many things we can do to form and maintain these relationships. And so would anyone like to say any last words now as we end this up? Representative Stewart?
Yes, first of all, thanks for having me on the panel. I did this last year when I was about 2 weeks into the job, and I feel much better, much more prepared with a year under the belt. I would just say, continue to contact your legislators, be present, be patient. We're up to almost 600 bills. I tell people, sometimes people come to the office and say, well, what do you think about House Bill 432? And I say, well, tell me what it is, because I've never heard of it. If it's not on our committee, it's not in our committee. A lot of times we just don't have bandwidth to know about every detail of 600 bills. And so help us be educated, be an advocate, but be realistic. There's a lot of other voices in healthcare. You pull one lever, three others go the other direction. And so be patient with us and understand you're in a crucial industry, but because of that, a lot of people care about bills related to healthcare, and it's not an easy road to hoe.
Thank you, Representative Stewart. Representative Manchester, would you like some parting words?
Sure. Thanks again for having me. And again, I just want to say thank you to all of our frontline healthcare workers for the hard work you've put in over the past 2 years. We are so appreciative. So please do stay in touch. Okay,
thank you. And Senator Rogner.
Thank you. I just want to echo that. Thank you to our healthcare heroes, all you nurses on the front lines. Thank you for all you do. Your sacrifice does not go unnoticed, and we are truly tremendously appreciated. Please do not hesitate to reach out to me at any time. You can just contact my office or me directly. I'll give you my cell phone number. It's 330-322-5325. Thank you for being here today, and thanks for listening.
Thank you. Representative White.
I also want to echo that. I can't even imagine having family members that are nurses, having experienced the care of nurses in a crisis and death this fall. I can't even imagine what you're dealing with, and I want to thank you for everything you've done. Please stay in touch with us. We need to hear directly from people, not just associations. We need to hear from people who are affected by the decisions and the bills that are going to happen. I'm Rep 41 at ohiohouse.gov. Send me an email. Our information is online to contact us. We greatly want to hear from you, because that's how we can most effectively make decisions. Thank you.
And thank you. Our stories as nurses are so critical for you all as you think about legislation. And Representative Russo.
Not too much to add, except, I can't emphasize knowing who your state representative, your state senator is. Do not hesitate to reach out to those individuals. We are all fairly accessible. And then I would just also encourage you, utilize ONA. You guys have great representatives and advocates there at the State House. Utilize the information that they send out. And, when they call you to add your voice to issues, don't hesitate to do that. It can be very intimidating for folks the first time to come, for example, and testify in front of committee. But once you've done it once, you're really an expert at it, and your voice does matter. And we do want to hear from you, and, show up and let us know. And that is the best way for us to make good policy, is to hear directly from the folks who have to then carry out and implement and, have to see the consequences of that policy. And hearing that those accounts from you is incredibly helpful to us.
And thank you all for participating today and for participating in many of our, for example, we have the Mid-Ohio District Nurses Association Candidates Caucus and Meet the Candidates Night in September. Go to these, whether it's League of Women Voters or any state or community organizations that have legislators there. It's so important to hear their message and for them to hear our nursing stories that are so impactful, and we can make changes. We can better the nursing community, better the patient care only through being able to talk and partnering with legislators. So this is so important, and we really, really appreciate you all being here today and giving us your views on different issues that are hot topics right now for us. And so we want the best patient care, quality workplace facilities, and we can only do this with partnering with people like you. So anyone else have any parting words they need to say that I might have missed? Okay, thank you all so much. And we look forward to seeing you in the future at many more of these events.
Bye.